When someone experiences bone pain, the first thought is often arthritis. After all, millions of people live with joint pain, stiffness, and discomfort every single day. It's one of the most common complaints doctors hear in their offices. But here's something most people don't realize. In rare cases, that persistent ache in the bones could be signaling something far more serious than arthritis. It could be bone cancer. Now, before anyone panics, it's important to understand that bone cancer is actually quite rare. It makes up less than 1% of all cancers. But the problem is this: because bone cancer symptoms can look so similar to arthritis, many people dismiss the warning signs until the disease has progressed. That's why understanding the key differences between arthritis pain and bone cancer pain could literally save someone's life. So let's talk about the 4 critical bone pain symptoms that could indicate cancer instead of arthritis, and more importantly, how to tell the difference. This information is presented in a very straightforward way, focusing only on what people absolutely need to know to protect themselves. First, let's establish what's actually happening in the body with these 2 conditions, because the mechanism behind the pain is completely different. Arthritis is a condition that affects the joints, those places where bones connect to each other. When someone has arthritis, the cartilage that cushions the joints wears down over time. This creates friction, inflammation, and eventually, pain. The pain from arthritis typically affects multiple joints, comes on gradually, and tends to worsen with movement. Think of it like a hinge that's lost its lubrication. It gets stiff and painful when it moves. Bone cancer, on the other hand, is an entirely different beast. It starts when abnormal cells in the bone begin to grow out of control, forming a tumor. This tumor grows inside the bone itself, and as it expands, it destroys healthy bone tissue. It's like having an aggressive invader breaking down the structure from the inside. The pain from bone cancer usually affects a single location, and it gets progressively worse over time, regardless of whether the person is moving or resting. That distinction right there, pain that affects multiple joints versus pain in a single bone location, is one of the first clues that something more serious might be happening. Symptom number 1: pain that wakes you up at night. Here's the first major red flag that bone pain might be cancer instead of arthritis. The pain is significantly worse at night, often waking the person up from sleep. Now, arthritis can certainly cause discomfort at night. People with arthritis often experience morning stiffness or may feel achy when they first wake up. But here's the key difference. Arthritis pain typically improves with rest. Someone with arthritis might have a rough day of activity, then feel better after lying down and getting some rest. Bone cancer pain follows the opposite pattern. It becomes more intense at night, and it's severe enough to interrupt sleep. The person might go to bed feeling okay, but then wake up at 2 or 3 in the morning with deep, throbbing pain in a specific bone. This isn't the kind of discomfort that shift's position can relieve. It's a persistent, gnawing ache that seems to drill deeper into the bone itself. Medical experts describe bone cancer pain as having a unique quality. It's often characterized as a deep, aching sensation that can suddenly become sharp and stabbing. Some patients describe it as feeling like something is pushing or pressuring the bone from the inside, which is essentially what's happening as the tumor grows. The reason bone cancer pain worsens at night isn't entirely understood, but researchers believe it has to do with changes in blood flow, inflammation levels, and the way the body processes pain signals when it's at rest. What matters is this pattern. If someone has bone pain that consistently wakes them up at night and doesn't respond to rest or typical pain relievers, that's a serious warning sign that needs immediate medical attention. Symptom number 2: pain that becomes progressively worse over time. The second critical symptom is the progressive nature of the pain. Bone cancer pain follows a very specific trajectory that's distinctly different from arthritis. Arthritis pain tends to be relatively stable. Someone might have good days and bad days. The pain might flare up after overuse or during certain weather conditions, then calm down again. It's variable and somewhat manageable with rest, ice, or anti-inflammatory medications. While arthritis can certainly worsen over the years, the progression is usually slow and gradual. Bone cancer pain, however, follows a relentless pattern of escalation. It might start out mild, so mild that the person barely notices it. Maybe it's just an occasional ache that comes and goes. But over the course of weeks to months, that pain becomes more frequent, more intense, and more constant. It's like watching a storm build on the horizon, starting with a few clouds and ending with a full-blown hurricane. In the early stages, someone with bone cancer might only notice the pain during specific activities, like walking if the tumor is in a leg bone. But as the tumor grows and damages more bone tissue, the pain transitions from intermittent to constant. Eventually, it doesn't matter if the person is active or resting, the pain is always there, and it keeps getting worse. This progressive worsening happens because the tumor is actively destroying bone tissue. As it grows, it releases inflammatory chemicals that activate pain receptors. It also creates pressure inside the bone and can stretch the periosteum. That's the thin, pain-sensitive membrane that covers the bone. All of these factors combine to create pain that intensifies over time. If someone notices their bone pain is following this pattern, starting mild but steadily becoming more severe and more constant over a period of several weeks, that's a major red flag that something beyond arthritis is happening. Sometimes this swelling appears weeks or even months after the pain begins. Other times, a person might notice a painless lump first, before any pain develops. The skin over the swollen area might feel warm or appear red, similar to inflammation. But the key difference is that it doesn't respond to typical anti-inflammatory treatments the way arthritis swelling would. Here's something particularly important. If the tumor is located deep within a bone or in an area like the pelvis or spine, visible swelling might not appear at all. That's why the presence of swelling is significant when it occurs. But its absence doesn't rule out bone cancer. The combination of localized swelling with progressive pain is what raises serious concerns. Another critical sign related to this is if the swelling or lump interferes with movement. For instance, if bone cancer develops near a joint like the knee or hip, the tumor can actually limit the range of motion in that joint. The person might find themselves limping or unable to fully bend or extend the joint. This movement limitation happens because the tumor is taking up space and potentially affecting the surrounding tissues and structures. Symptom number 3, swelling or a visible lump at the pain site. The third symptom to watch for is unexplained swelling or the appearance of a lump near the area of bone pain. Arthritis certainly can cause swelling, but it presents differently. With arthritis, the swelling typically occurs around joints, places like the knuckles, knees, or ankles. The swelling is usually symmetrical, meaning it affects both sides of the body in similar ways. For example, if someone has rheumatoid arthritis in their hands, both hands are likely to show similar swelling. The swelling might come and go, often responding to treatment or rest. Bone cancer creates a different kind of swelling. As the tumor grows inside the bone, it can create visible swelling or a lump in that specific location. This swelling is usually localized to one area, not symmetrical, and it tends to increase in size over time. The lump might be hard to the touch, or it might feel soft, depending on the type of tumor and how much surrounding tissue is involved. Symptom number 4, unexplained fatigue and weight loss, accompanying the bone pain. The fourth major symptom is when bone pain is accompanied by unexplained fatigue and weight loss, symptoms that rarely occur with arthritis alone. Let's be clear about what this means. Many people with arthritis do experience fatigue, especially if their condition is severe or if they're not sleeping well due to pain. And yes, some types of arthritis, particularly rheumatoid arthritis, can cause weight changes, but the fatigue and weight loss associated with bone cancer have a different quality and intensity. Cancer fatigue is profound and unrelenting. It's not the kind of tiredness that improves after a good night's sleep or a weekend of rest. People with bone cancer often describe feeling absolutely exhausted all the time, as if their energy has been completely drained from their body. Simple tasks like showering, getting dressed, or walking to the mailbox become monumentally difficult. This extreme fatigue happens for several reasons. When cancer is present, the body's metabolism changes dramatically. Cancer cells consume enormous amounts of energy as they grow and divide. The body is essentially working overtime, burning calories and resources at an accelerated rate just trying to cope with the disease. Additionally, cancer triggers an immune response that creates inflammation throughout the body, and this inflammatory state contributes significantly to feelings of exhaustion. The weight loss that accompanies bone cancer is equally concerning. This isn't weight loss from dieting or increased exercise. It's unexplained, unintentional weight loss that happens despite normal eating habits. In fact, many people with bone cancer experience loss of appetite as one of their symptoms, which contributes to the weight loss. But even those who are eating normally may lose weight because the cancer is changing their body's metabolism. Medical guidelines suggest that losing more than 5% of total body weight over a 6 to 12-month period, without any intentional changes to diet or exercise, warrants immediate medical investigation. When this weight loss is accompanied by persistent bone pain and fatigue, the combination of symptoms strongly suggests something more serious than arthritis is at play. There's also something called cancer cachexia, a specific syndrome where cancer causes the body to waste away, losing both muscle mass and fat. This can happen with bone cancer, particularly in more advanced stages. The person doesn't just look thinner, they look gaunt and weak. Their muscles atrophy, and they lose strength rapidly. Understanding additional warning signs. While those are the 4 main symptoms that distinguish bone cancer from arthritis, there are several other warning signs worth knowing about. 1 is pathological fractures. Bone cancer weakens the structure of the bone, making it fragile. This means a bone can break from very minor trauma, something that wouldn't normally cause a fracture in a healthy bone. For example, someone might fracture their leg while simply walking, or break an arm from a minor bump. These are called pathological fractures, and they're a significant red flag for bone cancer. Another sign is if the bone pain is accompanied by numbness, tingling, or weakness in the limbs. This can happen if bone cancer develops in the spine and the tumor presses on nerves. The person might experience these neurological symptoms along with back pain, and they might notice problems with coordination or even difficulty controlling their bladder or bowels in severe cases. Some people with bone cancer also develop low-grade fevers that come and go, along with night sweats. These are systemic symptoms, meaning they affect the whole body, and they indicate that something significant is happening internally. The critical importance of early detection. Here's the crucial point that everyone needs to understand. Early detection of bone cancer dramatically improves outcomes. The 5-year survival rate for bone cancer is approximately 80% when caught early, meaning someone with bone cancer is 80% as likely to survive for 5 years or longer compared to someone without the disease. But that survival rate depends heavily on the stage at which the cancer is detected. The problem is that bone cancer symptoms can be so easily mistaken for other conditions. Healthcare providers sometimes initially diagnose patients with growing pains, sports injuries, arthritis, or even Lyme disease, before eventually discovering the true cause is bone cancer. This misdiagnosis can delay proper treatment by weeks or even months. That's why it's so important for people to be aware of these distinguishing symptoms and to advocate for themselves with their healthcare providers. If someone has bone pain that fits the pattern described here, pain that wakes them at night, progressively worsens over time, is accompanied by swelling or a lump, and occurs alongside unexplained fatigue and weight loss, they need to insist on thorough testing. When someone presents with concerning symptoms, doctors use several methods to determine whether the pain is from arthritis, bone cancer, or another condition entirely. The process typically starts with a physical examination. The doctor will carefully examine the painful area, looking for swelling, lumps, or tenderness. They'll ask detailed questions about when the pain started, how it's progressed, what makes it better or worse, and whether any other symptoms are present. Imaging tests are crucial for diagnosis. X-rays are usually the first step because they can show abnormalities in bone structure. If bone cancer is present, the X-ray might reveal areas where bone has been destroyed or areas of abnormal bone growth. However, X-rays don't always catch bone cancer in its earliest stages. More advanced imaging like CT scans or MRI scans provide much more detailed pictures of the bone and surrounding tissues. These scans can detect smaller tumors and give doctors a better understanding of the tumor's size and whether it's affecting nearby structures. A bone scan is another tool doctors use. In this test, a small amount of radioactive material is injected into the bloodstream. This material is absorbed by areas of bone that are growing or healing rapidly, including cancerous areas. The scan then creates images showing these hot spots where abnormal bone activity is occurring. But here's the thing. None of these imaging tests can definitively prove that a tumor is cancer. The only way to confirm bone cancer is through a biopsy. In a biopsy, doctors remove a small sample of tissue from the suspicious area, either with a needle or through a small surgical procedure. That tissue sample is then examined under a microscope by a pathologist who can determine whether cancer cells are present and, if so, what type of bone cancer it is.